Hi, I'm Adrian Nuñez of BSN 3E, and in this video, I will demonstrate the safe administration of oxygen therapy. It will cover when and how to use different oxygen delivery devices, as well as how to prescribe oxygen for a patient. The treatment options include nasal cannula, simple mask, Venturi mask, and lastly, the reservoir bag mask. As with any procedure, introduce yourself to the patient and tell what are you going to do and have a consent. If you see your patient is showing signs of respiratory distress, we can check him how well the oxygenated blood through the use of pulse oximeter. The probe should be fitted securely and any nail polish must be removed as it can interfere with the reading. Wait till the SpO2 percentage will be shown. A healthy individual should have at least 94% above of SpO2. If he or she has a low level, this would indicate that they are hypoxic and need to be given oxygen as soon as possible. First device for oxygen therapy that we're going to use is the nasal cannula. This is recommended as being suitable for most patients with both type 1 and 2 respiratory failure. This is a hollow tube with two prongs which we are going to insert to the patient's nostrils. To make sure that it will not dislodge, we can place a tape behind ears for security. The other end of the tube is connected to some oxygen tubing, which then attaches to the oxygen cylinder. An alternative to nasal cannula is to use a simple face mask. This is less comfortable for the patient, but it can deliver slightly higher concentrations of oxygen. The oxygen tubing is connected to the plastic port at the bottom of the mask. The open side ports allow air to mix and dilute the oxygen as well as carbon dioxide to leave. It's time to put the mask on. As you can see, the mask can then be molded to fit over the patient's nose and mouth. It is well secured by an elastic band. However, it is difficult to know exactly how much oxygen is being delivered through a simple face mask. If a specific concentration of oxygen is to be delivered or the patient continues to deteriorate, well, it is recommended to use the Venturi mask. The Venturi masks are used in situations where patients may have or other risk factors for type 2 respiratory failure and high concentrations of oxygen may need to be avoided. The aim for oxygen saturations are between 88 and 92%. A 28% Venturi mask at 4 liters per minute can be used while some ABG is obtained. If the patient continues to deteriorate or has arrived in a critical condition, a non-rebreather mask is used. Finally, the difference of this device is that it has an attached reservoir bag and one-way valves which allow oxygen concentrations of 60 to 80% to be achieved. Once again, the oxygen is connected up and the flow rate is adjusted to between 12 to 15 liters per minute. The valve between the face mask and the reservoir bag needs to be pressed in order to fill the bag up. It can then be adjusted to fit over the patient's nose and mouth similar to previous face mask. In my conclusion, oxygen is a drug and it can be harmful if it's not used properly regardless of the reason. It must be prescribed by a doctor or physician. In emergency situations, it can be written up afterwards. If the patient remains stable on minimal oxygen therapy, consider discontinuation. Thank you for watching.